study aimed to determine the effect of zoledronic acid treatment on the risk of total knee replacement surgery. Bisphosphonates, including zoledronic acid, are a first-line therapy for the prevention and treatment of osteoporosis, and prior studies have suggested they may be effective in treating osteoarthritis. The participants of this current study were included as part of the ZAP2 trial, which was a double-blind, placebo-controlled clinical trial conducted in 223 patients with knee osteoarthritis. They had been recruited from 4 study centres in Australia: Hobart, Melbourne, Adelaide and Sydney. And participants were randomised to yearly infusions of zoledronic acid or placebo. We matched the ZAP2 trial participants to the Australian National Joint Replacement Registry, and primary total knee replacement surgeries were identified over a 7-year period. The effect of zoledronic acid on total knee replacement risk was evaluated using Cox proportional hazard regression models, and because the treatment effect failed the proportional hazards assumption, a time-varying coefficients analysis for treatment was conducted by splitting the study into 2 periods, the first 2 years of the trial and a post-trial period from years 2 to 7. So over the first 2 years of the trial, 7% of participants in the zoledronic acid group had a total knee replacement, compared to 1% in the control group. There was a trend that zoledronic acid was associated with a higher risk of total knee replacement surgery with a hazards ratio of 6.8. From years 2 to 7, 21% of participants in the zoledronic acid group had a total knee replacement compared to 17% in the placebo group, and there was no association between zoledronic acid treatment and the risk of total knee replacement surgery in the post-trial period. So in conclusion, these results are suggesting that zoledronic acid did not reduce the risk of total knee replacement surgery over 7 years, and our finding that zoledronic acid treatment resulted in a slightly increased risk of total knee replacement during the treatment period is unexpected and needs further confirmation in other randomized controlled trials, and the clinical implications remain unclear at this stage. The overall take-home message of this work is that zoledronic acid was not protective against total knee replacement in patients with knee osteoarthritis, and this supports the current clinical recommendations that zoledronic acid should not be used to treat knee or hip osteoarthritis.